physical therapy in Chanhassen, Minnesota. My name is Dr. Ben Bloomer. I'm a licensed physical therapist here in the state of Minnesota, and glad to be back on Facebook Live doing a video with you all this morning. Before we get started, I just want anybody who's out there watching, whether you're watching live or watching it on the playback, give us a like, give us a heart, give us a wow face, something out there just to let me know that you can hear me. As we're going through the video, if there's something that you enjoy or that you like, hit the like button. If you've got any questions, again, whether you're watching it live, leave me a comment. I'll try to answer any questions as we go live, and I'll also check back periodically to take a look at the comments or questions afterwards and respond. So in just a moment, we're going to get started here in talking about some of the myths about physical therapy. And I'm going to do this in a series. So today we're doing part 1, and I'm going to try to tackle or debunk 2 of the most common myths about physical therapy. And by the time we're done with this series, we're going to try to tackle 10 myths about physical therapy. Things that my patients have questions about, things that the public has questions about, things that people wonder. So the very first myth that I'm going to tackle is that you need a referral or an order from a doctor to see a physical therapist. And over the last 5 to 10 years, that has become totally false. You do not need an order or a referral from a doctor to see a physical therapist anymore, which is awesome. The reason why that has become true, or the reason why you don't need a referral anymore, is because physical therapists like myself have gone through some extra education while we're going through physical therapy school to be able to get our doctorate degree. So we all graduate with a DPT, a Doctor of Physical Therapy. And the reason that we did that was so people could come directly to a physical therapist without having to waste their time at the doctor's office or any other referral source like a dentist or a chiropractor. You don't need that anymore. And the vast majority of all health insurances in the state of Minnesota will still cover and pay for you to go to a physical therapist without that order or without that referral. That's probably the biggest myth out there about physical therapy, and we're still trying really hard as physical therapists to educate the public and educate anybody that we know that you do not need a referral from a doctor anymore to see a physical therapist. Now, if you do see a doctor and they do send you to physical therapy, that's great, and obviously we'll take it and we'll put it on file, but you do not need that referral anymore, which is awesome. Makes your life a lot easier as a patient or as a consumer of healthcare. If you have just a minor ache in your back or a knee pain that's been going on for a while, or maybe you just recently strained your shoulder putting up Christmas lights or shoveling this past weekend, we got a lot of snow, and you know that there's nothing really serious going on. You don't need to get an x-ray. You don't need to see a doctor. You just need to go see a physical therapist to get some exercises, some stretches, some strengthening to get you back on track and get you back to the activities that you love to do. So again, myth number 1, you do not need an order or a referral to come to physical therapy anymore. Okay, myth number 2, another common thing that I hear is physical therapy is very expensive. And now, relatively speaking, in terms of what's expensive and what's not expensive, physical therapy is not at all expensive. In fact, physical therapy is quite cheap, especially when you compare physical therapy to some of the other forms of healthcare, pain management, pain relief that is out there. For example, let's take a regular visit to your doctor. If you get injured, let's say you hurt your back shoveling snow, and you go to the doctor, let's talk about some of the costs that can add up quite quickly if you go to the doctor's office. So most doctors, on average, for that initial consultation or initial visit or initial evaluation, you're going to be paying somewhere in the ballpark of about $300 For specialists, maybe upwards of even $500 just for that doctor to see you and spend 10 or 15 minutes with you. So then let's say the doctor takes a look at you and they think, okay, let's do an x-ray. An x-ray is going to cost on average somewhere around $200 to $300 depending on the location that you go. And they take a look at the x-ray and okay, everything looks fine, everything's normal, but we're really curious what's going on. So let's do an MRI, which is going to show a better picture of your muscles, your nerves, your discs. And an average cost of an MRI, you're looking at about $2,500. And before you've even received any treatment, anything at all, you've incurred upwards of $3,000 to $4,000 of costs just to see a doctor, get an x-ray, and do an MRI. $3,000 to $4,000 before any treatment has ever even occurred. Now let's say that they look at your MRI and maybe they see a couple things worth noting, but overall nothing serious or nothing severe. So what are they going to do? Oftentimes their first form of treatment is to prescribe maybe some muscle relaxers or a pain medication, whether it's hydrocodone or oxycodone or Vicodin. And that's going to be a couple $100. And okay, now you're up to $4,000, $4,500. Take the pills, and is that even really fixing or doing anything to help you? Not really. No, not at all, in fact. So then you go back to the doctor for a follow-up visit. There's a couple $100 more. And now the doctor says, okay, the pain pills weren't working. Let's try an injection. Maybe a cortisone shot will fix it, or an epidural shot. And the cost of that injection's another $300, $400, $500. So pretty quickly you have accumulated upwards of $5,000 in healthcare cost before ever really getting any valuable treatment that's going to help cure or fix the problem that's going on. And now we take it one step further, and let's say that those couple little things on your MRI, now the doctor wants to do a surgery on you because you're still not getting better from the shots or the pain pills. So now we're talking back surgery, or any surgery for that matter. And now we're talking like $25,000 to $30,000 or more that you're going to pay. And again, a lot of this stuff is not even truly going to help you in the long run. And you can see how these costs can really add up very quickly. Now, take that picture of $5,000 at minimum sometimes with a doctor visit, all the way up to $30,000 or more getting a surgery, and compare that to physical therapy, where you're going to be getting some one-on-one time with a doctor of physical therapy like myself for about an hour every time that you come in for a visit. And on average, every time that you come in for a visit, you're going to pay right around $100 on average, depending on your insurance plan or your coverage. And on average, most people come to physical therapy for about 10 to 12 visits times $100, and you're going to be paying somewhere in the ballpark of about $1,000 is very average or typical amount of costs that you are going to have to pay, or your insurance is going to have to pay for treatment. And this adds up to, again, about an hour. So you're going to be spending upwards of 10 or more hours with a physical therapist and actually doing some things that are going to help you immediately, and definitely do some things that are going to help fix you in the long term. Physical therapy isn't the quick fix, but it's definitely the best long-term fix, addressing your posture, addressing areas of weakness, addressing areas of tightness, doing some hands-on manual therapy in an effort to reduce your pain and get you back on the road of life. So to me, again, the cost of physical therapy, something that's going to help you long-term and prevent further issues and injuries from happening, is well worth it, well worth to your dollar, to be able to do the activities that you love to do without pain. And again, $1,000 on average, comparing upwards of $5,000 to even $30,000 or more for something that might not even help. So again, myth number 2, Overall, physical therapy is not at all an expensive treatment. In fact, it is quite cheap. So if there's anything that you have questions on or a comment on, please feel free to leave it in the comments section. Feel free to reach out, give us a phone call. Our number is 952-491-4700. We'd love to chat with you. We can schedule your free consultation today to see me. We'll do a free one-on-one treatment for your very first time in, or please feel free to reach out to me via email. My email is bbloomer@thriveptmn.com. Visit our website, www.thriveptmn.com. We'd love to hear from you. We'd love to see you. This was just part one, debunking two of the biggest myths. Number one, again, you do not need a referral to see a physical therapist. And number two, physical therapy is not expensive. Look forward to seeing you again next time for part two. We'll tackle two more myths about physical therapy. Thanks. Have a great day.